In this webinar, we shall learn about the indications of oxygen therapy in neonates. Oxygen is one of the most commonly administered drugs in the neonatal intensive care unit. Oxygen therapy is administration of oxygen at concentrations greater than that in ambient air with the intent of treating or preventing symptoms and manifestations of hypoxia. The goal of oxygen therapy is to deliver adequate amount of oxygen to the tissues without causing oxygen toxicity. One needs to be aware of the judicious and correct indication for use of oxygen in neonatal intensive care so as to avoid both hypoxia and hyperoxia. Optimal use of oxygen in neonates is essential for maximizing short and long term growth and development while minimizing its harmful effects. We shall not be covering use of oxygen in neonatal resuscitation in this webinar. Hypoxia, as defined by oxygen saturation less than 90%, is the single most important indication for use of oxygen in neonates. While giving oxygen in babies, the clinical situation has to be kept in mind. Indication for oxygen is saturation less than 90% in neonates. In case of availability of arterial blood gas facility, partial pressure of oxygen less than 50 in preterm is indication for starting oxygen. Let us study the rationale of oxygen therapy. In babies with respiratory distress, unless they are hypersaturating, one would give oxygen and titrate. The logic being that babies who are breathing fast are hypoxic. By giving oxygen, the respiratory rate may come down, but the healthcare provider should avoid hyperoxia by titrating. Use of oxygen is widely practiced in babies with apnea. Oxygen helps in improving the carbon dioxide sensitivity by the brain in preterm neonates. However, one needs to avoid hyperoxia. In babies with shock, use oxygen if pulse oximeter is unable to get saturation readings. However, if saturations are above 95%, wean the oxygen. Supplemental oxygen must always be monitored. In level 3 neonatal intensive care unit, there should be facilities for arterial blood gas analysis and pulse oximetry. There is enough evidence that unmonitored and unrestricted use of oxygen in neonates has potential harm without any clear benefits. The only indication for use of oxygen in neonates is hypoxia. Thank you.